is long overdue. I am finally telling my birth story. I am 5 months postpartum from having my first baby and finally sitting down, got all the details ready for you guys to tell my birth story of having my baby at 36 weeks in an emergency induction because of preeclampsia. So I started developing preeclampsia at around 32 weeks. At my 34-week checkup is when we really noticed it. So I started having weekly ultrasounds. I went to my 36-week appointment and my ultrasound was at 11. Baby looked great, but she wasn't growing as much as she normally had been. Like she was like in the 70th percentile and had dropped to 50th in like 2 to 4 weeks. That was kind of concerning for me. And then my blood pressure, I was already on blood pressure medicine. My blood pressure at my appointment at 1 p.m. was 160/100. And my doctor came in and said, I think it's time to get this baby out. And I agreed. Also, if you hear like any rattling or crunchy books, Layton is playing in her crib right now. So you guys might hear some baby giggles. I was already on blood pressure medicine and he actually that Friday before, so 2 days before, gave me the steroids for baby's lungs to develop better because he did think I was going to have to be induced soon. So anyways, fast forward back to Monday, I was at my 36-week checkup. I was 36 weeks in 1 day and they decided to induce me. So at 3 p.m. I went to labor and delivery and we were ready. I got my IV, I changed into my gown. I actually had my hospital bag in my car because I had a feeling that I would be induced that day. I actually spent that day, like I got my nails done, I got my eyebrows done. I was like, if this is my last day before being a mom, I am going to treat myself. And I'm so glad I did because I was right. If you see me looking over here, I'm literally checking my notes because so much happened and it was 5 months ago that I want to make sure I'm telling you guys everything that I can. So my first dose of Cytotec, which is a cervical ripener, was at 345. They checked me when they did that. I was only 1 centimeter and 0% effaced. They put that in and they told me just to hang out in bed for 45 minutes and then I could go walk. So I started to walk around 4:30. I wasn't having any cramping, literally nothing. My husband and I walked around. It was a smaller unit, so we already did like 5 laps in like 10 minutes. And then my nurse stopped me and was like, because of your preeclampsia, they want you on the monitor and they don't want you walking around. Which was a bummer for me because I really wanted to have an active labor. I wanted to be an active participant in my labor. But my blood pressure was still 150/90s. Close to 160/100, and that's when they really start getting concerned. So we went back into the room. She did say I could sit on the labor ball but not do anything like too crazy. So I did that for a little bit and then she came back in and was like, we really need you to stay in bed. So like I said, that was a bummer. That was not the expectation that I had for my labor, but that was what I needed to do at the time because of my blood pressure. So between really 4:30 and 7:45, we were just hanging out in the room. My parents stopped by to see me. My mom came and braided my hair and we had dinner. And then at 7:45, they came in to do my second dose of Cytotec, which was the cervical ripener. This is to help get your cervix ready, induce labor. At that time, I was still only 1 centimeter, but I was 50% effaced. So some stuff was happening. I started to have cramping, but like literally nothing even compared to period cramps. It was just like an ache that something was going on. She was very, very low. And so when they did check me, they had to like go around her head kind of to check me. And that was painful, but it was reassuring that she was so low that she would be ready once I was dilated fully. So I was at 7:45 and my blood pressure at 8 was 158/96. And they said that if it was 160/100, they would want to start the magnesium protocol for preeclampsia. Magnesium is for seizure prevention because with your blood pressure being high and preeclampsia, you're at risk for seizures, which is a very bad thing for mom and baby. So my nurse told me that I would potentially have to be put on the magnesium drip, and I honestly did not even think about this as an option with the preeclampsia. I thought they were just going to induce me and control my blood pressure, and then I would have my baby. So she came back after talking to the on-call doctor, and they decided, because I was still having really severe headaches even after my labetalol, both of my doses of labetalol that day, that they decided I should get the magnesium drip because of my symptoms and my blood pressure. So they gave me a magnesium bolus, which it went in over, I think, like 20 minutes. And the nurse had to stay at my bedside the whole time because it can drop your blood pressure. It can cause some neurological symptoms. So she stayed with me the whole time. It made me so hot. Like, I was sweating so much. Thank goodness I had like my little stroller fan. I literally was sitting there with the fan in my face. That was probably one of the worst parts of my induction, but it was completely separate from... One second. Ow, my hair. You have mommy's hair. Okay. Oh my gosh. The magnesium bolus was pretty terrible. It made me feel pretty awful, but it was quick. And then I stayed on the magnesium drip for the duration of my labor and 24 hours postpartum. I did not understand how serious the magnesium drip and my preeclampsia was at the time. They had to come in and do hour checks because I was on the magnesium for checking my reflexes and my blood pressure to make sure the magnesium can have an effect on your reflexes, and that would be if like the drip was too high and it was too much magnesium. So they have to check your reflexes to make sure you're not getting too much magnesium. It can also depress your respiratory drive, and so they want you hooked up to the oxygen saturation monitor and the blood pressure monitor all the time to make sure that you are not breathing. So I was 1-to-1 with my nurse, which means she didn't have any other patients because I was a high risk labor. So my next check was at midnight. I was 1.5 centimeters, 70% effaced, and they gave me Cytotec again. So this was my third dose of Cytotec, which is the cervical Regner, which gets your body ready for labor. I had only progressed in 8 hours, 0.5 centimeter, and that was with 2 doses of Cytotec, but I became more effaced. So I started out 0% effaced, and 8 hours later, I was 75% effaced. You have to take into consideration, I was 36 weeks in 1 day when I was induced, so my body should not have been ready for labor anyways. This is pretty early to be inducing labor, but we had to because of the preeclampsia. Ow! The cramping was starting to intensify a bit after that third dose of Cytotec. However, I don't feel like I was having contractions. On the monitor, I would have little contractions, like very small ones, but they were nothing compared to what they needed to be for me to be in like active labor. So between midnight and 3 a.m., I was just trying to sleep. However, they came in and were waking me up every hour to check my reflexes and blood pressure. And then at 3:45, my water actually broke on its own, which was wild. I was not prepared for that. I was actually fully prepared for them to have to break my water. What happened was I was laying back and I had my husband sit the bed up some because my lower back started to get crampy. That's really where I was feeling most of the pressure and pain or discomfort. So I sat up, I was sitting cross-legged in bed, and then it literally was just like a balloon pop. I'm not kidding. This sounds like it's out of a movie, but it literally was just like a balloon pop and then a gush of fluid. And I was like, my water just broke. And my husband was like, really? And I was like, yeah. And so this was 3:45 a.m., literally 12 hours after my induction started. So at that point, my nurse had just left from checking my reflexes. We called her back in and I was like, hey, I think my water just broke. And she's like, are you sure? Like, you didn't just pee? And I was like, no, I'm pretty sure my water broke. So she checked me again and she like put the glove on and was checking me, and she was like, oh yeah, your water definitely broke. And I was like, I told you so. And I was only 1.5 centimeters though when my water broke, which is crazy. She was pretty surprised too. After my water broke, they couldn't do the Cytotec anymore because now it was time for Pitocin. Once your water breaks in an induction, they do Pitocin. So they started doing Pitocin. I was still getting the magnesium drip at this time. So I had an IV with my magnesium drip going and an IV with my Pitocin going. Once the Pitocin started, shit got real. The Pitocin was started around 4:15 and my contractions really started to intensify at 5 a.m. At 5:30, I was very, very uncomfortable. You could see the contractions on the monitor. They started like really spiking and peaking, and they were lasting like a minute. Pitocin makes your contractions longer and more frequent because it is a synthetic drug to induce labor. And so my contractions, I would have like no break in between them. And my husband was like rubbing my back, my lower back. That's where my contractions were. I felt my pain, not in my stomach. My stomach didn't even really harden when I had contractions. I felt them in my hips. I felt like there was fire in between my hips, but it was just the weirdest pain. It was so hot, like my hips and my pelvis. It was sharp and hot, but not crampy anymore. So with the Cytotec, I was feeling cramps, but then with the Pitocin, it was way more intense, way quicker. So like I said, at 5:30, the contractions really intensified, and I called my nurse in and was like, is there any way I can get an epidural? This was about at 6 a.m. and she was like, there's a C-section and an epidural before you, but hopefully they can get you in like as soon as possible. And I was like, oh God, I don't know how long I can do this for. And she checked me and I was only 3 centimeters. I was 3 centimeters, but I went from 1.5 to 3 centimeters pretty quickly with the Pitocin, and I was getting no break. I couldn't relax in between the contractions because they were so frequent and so long. While I was in labor and having the contractions though, I was on the ball, bent over on the hospital bed, and my husband was behind me putting counter pressure, and that did help a lot. I did not want to do morphine because the magnesium was already making me kind of foggy and sleepy, and I did not want to do morphine on top of that to make me even sleepier, because I really wanted to try to be as present and active as I could be, even though I couldn't get out of bed with the magnesium except to be on the ball at the bed. So the anesthesiologist came in really quickly though. I could have kissed her. She came in and I sat up on the side of the bed. They brought the bed up high and they had a table in front of me and my husband across the table from me, and I was holding on to him and I had my head down, and then my nurse was on the other side of my husband and she started rubbing my shoulder during my contractions, and I felt so bad, but I moved my shoulder because I just did not want to be like consoled and touched. I was just in so much pain and I was frustrated because I could not help my pain. Like I could not get in a comfortable position because the way they had me sitting in the bed for the epidural. So I was having contractions as they were numbing me up for the epidural, cleaning me off and putting the epidural in. It was so hard to stay still, guys. Like when I was having the contractions before the epidural, before we even started that, I was using my feet to like ground me through the contractions. But when they have you getting ready for your epidural procedure, they lift you up so that your spine, your back, is where it needs to be for the anesthesiologist. That was the hardest part for me, was staying still during the epidural. And honestly, I was so terrified my whole pregnancy about having an epidural and like scared of side effects and stuff. In that moment, I did not care about the epidural. I was in so much pain. I just wanted it to stop. So they cleaned me off. She numbed me. I felt like the numb pinch, but honestly, having those contractions, it was like a distraction. And I just knew that if I could sit still for like 5 minutes, the pain would get so much better and it would be worth it. When she put the epidural in, I could kind of feel I don't know how to describe it. I felt like a pinch to my left side. And when they put the medicine in, I immediately started feeling relief on my left side, but not my right. Now my left side was completely numb. I couldn't even lift my leg up. It was actually a little too strong. My right side, I could pop my leg up. So because of that, they had me lay on my right side because the epidural is dependent, which means if you change sides, you can like move the medicine to that side of your spine, your epidural space. So when I moved to my right side, that's when I could feel the numbness start to get on my right side. The nurse said that they could redo the epidural, but I just did not want to go through it again, and it was good enough and when I changed positions, it was perfect. I would 10 out of 10 get an epidural again. It was the best decision I made for me. I wanted to try to get to like 7 centimeters before the epidural. I don't know what I was thinking. That pain just was not what I was prepared for. And knowing that I could have a more enjoyable labor experience, especially with the magnesium that I had going on, I was all for the epidural, and I'm so glad I did it. So that was at 7 a.m. by the time the epidural was done, and I was 3 centimeters when I got my epidural. My night shift nurse said goodbye. My day shift nurse came in, and I told the day shift nurse, I really want to be on the peanut ball. Now that I have the epidural, I can't do anything, can't move, can't get out of bed, especially with the magnesium. They did not put a catheter in me. They just did they emptied my bladder in and out, but they didn't leave a catheter in, which was nice. So she went and got the peanut ball and laid me on my right side to help the epidural go to my right side. And that was at 7 a.m. And then she came in at 8 and switched me to my left side. And then at 9 a.m. the doctor came in. This actually wasn't my doctor, but it was a doctor that I had seen in triage because I'd been in triage because of my blood pressure a few weeks ago. And I really, really liked her in triage. And it was so funny because when we had her a couple weeks before labor, like before delivery, I told my husband I wouldn't be mad if she delivered our baby. And she ended up being the one delivering our baby. But anyway, she came in at 9 a.m. and checked me, and I was 9 centimeters. So from 7 a.m. to 9 a.m., I went from 3 centimeters to 9 centimeters, and I felt nothing. I felt nothing, guys. That nap I took after the epidural was amazing. I slept so hard because all night I had been getting checks every hour because of magnesium, and I was still on the magnesium, but I slept through it. The epidural was amazing. So she came in at 9 and said I was 9 centimeters. And she was like, I'm going to give you a couple more hours to labor down and get to a 10. And my nurse then put me on the peanut ball the other way again. So we switched back and forth on the peanut ball 3 times, I think. And then at 10 a.m., I just was laying on my back at like a 30-degree angle and just resting. I was so tired. The epidural kind of does make you sleepy too because it has fentanyl in it. But I was just trying to save my energy before having this baby because I didn't know how long I was going to have to push for. I didn't know how I was going to feel. I could not feel a contraction at this point though. I couldn't feel anything. So the OBGYN came in at 11 to check me again, and I was 10 centimeters and ready to go. I was half asleep still. Like when she was checking me, I was like laying back. I couldn't feel anything. I was asleep, and then she was like, we're going to start pushing soon. And I'm like, what? We're going to do what? I can't keep sleeping. So they started getting the stirrups ready. I originally thought I wanted to push not on my back, just because I had seen a lot of people talking about how having gravity helps you. Laying on your back sometimes isn't the best labor position, but because of my epidural and magnesium, I wouldn't have been able to move very much anyways. I felt like I was in jello. So they got the stirrups ready, and the doctor started telling me like how to push, to do some practice pushes. And she was still like, she had her hand in there to feel my contractions and feel how I pushed in Layton's head. And she would look at the monitor and then tell me when to push based on like when my contractions were happening. I could not feel contractions. And so I had to have them tell me every time when I should be pushing, because I could not feel, I could feel the tiniest pinch in my right butt cheek, but that was it. And so I did some practice pushes, and this was at like 11:15 once we started really doing practice pushes. And they called the NICU to come to the delivery because she was going to be 36 weeks and 2 days. That's how old she was going to be when she was born. And that is very early for a baby. Although she did have her steroid shots, they still prepared me for her to come out not breathing well, limp, saying she might not be eating well. The magnesium can cause babies to be very lethargic when they're born. And so we were prepared for the worst. And so they had NICU ready on standby. And so NICU was called, and then it was like 5 minutes later, and the doctor was like, the NICU really needs to get here, because I was actually progressing really quickly with my pushing. Oh my gosh, I forgot to tell you guys the craziest part. I used the mirror to push because I could not feel anything. And they said that if I couldn't feel anything in the next couple contractions, they would turn my epidural down. So we used the mirror so that I could tell that I was pushing in the right spot. I never thought that I would use the mirror in labor. I always thought it was like pretty disgusting and cringy, like who would want to see that? But it helped me so much with my pushing and knowing that I was using the right muscles to push. So yeah, I watched her head as I was pushing, and that actually gave me so much motivation that like my baby is right there, and it made me push harder. Even though I couldn't feel anything, I knew I was pushing in the right place because of the mirror. I kept pushing with the mirror. I pushed about 3 times with the mirror, like 3 contractions. And the doctor was so sweet. She literally was just like sitting on the bed and talking me through it. She was very, very calm. My husband was on this side, my nurse was on this side, and then they had another nurse in there who was like getting ready to take videos and pictures as long as everything went well. They let me prop up my phone to take a video of the delivery so that I could remember that, because I told her, I was like, I feel so foggy. But my husband was just like rubbing my head and holding my hand and just being there for me. I pushed a few times and she came out and I didn't feel anything. I was so numb from like here down. My belly was numb. And they immediately put her on my chest and she started crying. And it was just the greatest feeling in the world. Like, we were so prepared for things to go bad because of the magnesium and the preeclampsia, and she looked great on the monitor. She started to have some heart decelerations while I was pushing, but they said that was because of her head squeezing through the birth canal. But to hear her crying and moving, and she was on my chest and was like real and alive right there, I've never felt anything like that before. There's nothing that feels like that. So they immediately put her on my chest. They were cleaning her off, and then they were like, she looks kind of small, like, do you care if we go weigh her? And NICU was in the corner next to the bassinet in the warmer. So she was only 5 pounds 6 ounces, but they said she looked great besides that. Like, her tone was good, she was crying, her color was good. So they gave her back to me after they weighed her, and we did our golden hour. During that time, my placenta was delivered. I did not feel that. And then the doctor did tell me I had a 2nd-degree tear that she was going to stitch up, and a periurethral tear that she was just going to leave, because she said sometimes stitching those can make it worse. So she did that. I still didn't feel anything, and they turned off my epidural then, and we spent that next hour having golden hour with her, and it was just truly the most surreal and amazing thing in the world. Although it wasn't the birth experience that I expected or planned, I really think I had a positive induction experience. The magnesium and preeclampsia is a whole nother story. I had to stay on that for 24 hours post-delivery, and we were in the hospital for 3 nights, and I can make another video about our hospital postpartum experience and my preeclampsia experience. There's a lot that goes into that. But as far as my induction goes with the Cytotec and Pitocin and my epidural, I really could not have asked for a better experience. My nurses were very, very supportive. The doctor was the perfect doctor for me, and it went so well. I would do it again. 10 out of 10 would have a baby again. I think going into it with an open mind and knowing that some things are out of my control, and a lot of things are when you're in labor, really did help. I'm just so thankful that we were both healthy and we turned out okay, and I had a really positive induction experience with my first baby. I hope you guys enjoyed hearing about my birth story. I am 5 months postpartum now, so I have learned a lot in the last 5 months, and I'm still learning things every day. If you guys want more, you can ask questions about literally anything, and I will either make a TikTok about it or try to do a Q&A on my experience with pregnancy and motherhood. I think that would be super fun if we could do a little Q&A. So ask me any questions you guys have. I love you all. Thank you for listening, and I'll see you next time.